The Christian Health Association of Kenya is a national faith-based organization of the Protestant churches, health facilities, and health programs from all over the country. It brings together various denominations and their health institutions, from the teaching and referral hospitals to colleges of training health workers like nurses, to community-based healthcare programs. Our main mission is to continue the healing ministry of Christ, just providing compassionate, quality health services to the people who most need it as an expression of the ministry of the church. Currently, we have over 540 members. Amongst these, we have 22 hospitals, about 53 health centers. Majority of the rest are dispensaries and some community-based healthcare programs. But in addition, we have 13 colleges providing training for middle-level health workers. Maternal health and child health is a key priority globally and in our countries. And is one of those Millennium Development Goals many developing countries are struggling with. And as health workers, we know a family and a woman having the right timing, having the right spacing, having the right number of children that she or they can be able to adequately support has an impact on the health of the child and the woman and the family. Then we have people who have other health challenges, which make them even a lot more vulnerable to complications related to pregnancy and childbirth. So we understand that each individual may have what is optimal in terms of what they can have and so on. Then depending on what method of delivery and what complications have been experienced when one is delivering, we know that subsequent deliveries have to be properly timed, properly managed, and well assisted by a well-equipped health facility and health workers to ensure safety of both the mother and the outcome, good outcome of the pregnancy. First and foremost, I think to clarify, sometimes we've had misconceptions about religious and faith-based institutions and leaderships, positions and perceptions about family planning. I think we like to make it very clear about our perspective of what family planning is. It's about empowering women and families and their husbands and their spouses and their families to make their choice, the most appropriate choice in terms of timing of the pregnancy, about spacing that is healthy, about the number that is both healthy for the woman and for the child, but also that as a family they're able to adequately support, through the developmental stages of a child up to the time they're educated and so on. So with that common understanding, ideally, would appeal to the church, both within our countries and outside, that we have a shared understanding about what family planning is about, and then appreciate why it's important, because it's considered one of the best strategies in improving maternal health and child health, particularly neonatal newborn health. That by assuring the health of the woman, by assuring the health, we're able to improve the health and ensure healthy delivery, healthy child that is born, and then a family that's able to adequately cater and support for their children. Our membership is quite diverse, so depending on what member institution you're talking about, the scope of the service can be quite varied. The Protestant churches generally embrace family planning, both artificial and natural methods. So the hospitals will provide a full range, from short-term methods to long-term, including permanent contraceptive methods. As you get new capacity within a health facility, they identify services that they could add to the list of what is already provided. And particularly when you have health workers that know the value of a service like family planning and the benefit, they can actually recommend to management to establish service. However, one limitation to this is where the owners of the facility, say a faith-based organization, a particular church, or if it's a private sector facility, have certain restrictions about the scope of service they can offer. So church may say, we don't want to offer any artificial methods. So if that's their choice, then as a health worker, you can demand, I must provide it. You can provide information to the clients that you think would benefit from it and advise them or refer them to an alternative provider within the neighborhood who would be able to provide that service. Family planning is an English terminology, so communities will use whatever terminology comes close. I think the key thing is, I think key message will be about spacing children. What probably may not be a very popular terminology is this of stopping childbirth. I think those are not, African traditional communities would not be a very easily used terminology. But in terms of spacing childbirth, that they will describe it in their own way, and those discussions actually do take place, particularly amongst women who really bear the greatest burden in unwanted pregnancies. But it varies from community to community.